I'm Bridget. I'm a postdoc in Citran in the University of Sheffield, and I'm also, just as Osman introduced, just joined as an ECR rep as well. So today I'm going to be talking about a very small portion of my project, which is looking at cortical microvascular disease and dementia. So very quickly, what is the role of vascular pathology in dementia? Why look at dementia for a start? First of all, the prevalence of dementia is only increasing with our ageing population and treatment options remain limited. So this is a really important area to develop further understanding in. So vascular disease is the second most common cause of dementia, accounting for approximately 20% of cases of dementia. But vascular pathology is also a common comorbidity observed at postmortem with other forms of dementia. And vascular risk factors such as diabetes, hypertension, insulin resistance, and obesity are also independent risk factors for the development of dementia in later life. So we can see these things are clearly linked together. So multiple vascular pathologies are associated with the development of cognitive impairment and dementia. So when we look at our larger blood vessels, pathologies such as infarcts, pathologies such as atherosclerosis are associated with the development of infarcts. And in turn, this can result in things like hemorrhage and stroke. And in fact, we see that 10% of patients will go on to develop dementia following their first stroke. Looking at small vessels, we see pathologies such as atherosclerosis and cerebral amyloid angiopathy are associated with the development of lacunes, white matter lesions, and bleeds. And while these are commonly seen in the aging brain, they are much more frequently observed in people with dementia as well. And because of this data, a lot of the research is focused on the role of small and large vessel disease in dementia. However, we wanted to look at what the role of microvascular disease, so looking specifically at the capillary level, is in dementia. So microvascular disease and its contribution to dementia are not very well defined in the literature, and this makes it really challenging. So our aim for this project was to define cortical microvascular disease in a representative ageing population and to examine the relationship between MVD pathology and changes in the microvascular unit with dementia-associated neuropathology and risk factors. So to do this, we have used brains donated to the Cognitive Functioning and Aging Study, or CFAS. So this is a population-based longitudinal study of cognitive impairment and dementia in the UK population. So we have 550 brains which have been donated to 6 centres across the UK, with the idea being that these 6 centres can help to better represent differences in socioeconomic status. Patients are not recruited based on clinical or diagnostic criteria, with the idea being that they can represent the full spectrum of ageing and pathology. A quick thing to note, I am currently completely blinded to dementia status in our patients, so apologies if you ask me any questions because I can't answer that at this point. But we do have existing data that we've collected on various pathologies, including Alzheimer's type pathologies and measures of small and large vessel disease. So today I'm going to be talking about one very small aspect of the project, which was looking at capillary density in the grey matter from one of our CFAS cohorts. And to do this, we've stained 117 brains in the frontal cortex for collagen 4 to identify our blood vessels. We've then taken belt transects as a measure of quantifying the grey matter, and then quantified our staining using QPath. And we've then compared these to existing data that we have within the lab. So starting with our results, we see that capillary density in the ageing brain varied greatly. So we have a normal distribution, but as you can see at the very low end of our spectrum, we've got these vessels which are very kind of spaced out versus at the upper end, much higher density. First, we looked at using existing data that someone else in our lab had previously collected from the temporal cortex. We compared our findings in the frontal cortex with theirs, and we found that capillary density appeared to be greater in the frontal cortex. And as these cases all of this data was collected in the same cases, we performed correlation analysis to see whether this was associated with individuals who had higher capillary density. And what we found was no correlation. So this indicates that overall it does appear to be that there is greater capillary density in the frontal cortex compared to the temporal cortex. Next, we looked at measures of Alzheimer's type pathology, looking at Braak stage as a measure of tau and TAL stage as a measure of amyloid pathology, and found no relationship here. And then we went on to look at measures of small vessel disease, starting off with cerebral amyloid angiopathy. So this is a process where amyloid is deposited into the walls of small vessels, and this causes them to become hardened and makes leaks in the blood vessels more likely. We looked at 3 different measures of CAA, including a binary score of whether it was present or absent in the brain, what type of blood vessel was affected, so whether it was capillary or larger vessel, and finally the number of brain regions affected, and again showed no relationship. And looking at another measure of small vessel disease, we looked at microinfarct status. Again, here we found no relationship, but it's worth noting, probably is quite a good thing, we had very few people that actually were scored in the more severe cortical microinfarct stages. So this indicates that this could be a little bit underpowered here. So to conclude, we have shown that capillary density does not appear to be related to measures of small vessel disease or measures of Alzheimer's type pathology. So its contribution to dementia may be independent of these existing pathologies. We are currently using immunohistochemistry to further widen the cohort that we're looking at, so we're including another 2 of the CFAS cohorts. And we're also looking at markers of other cells within the microneurovascular unit, as well as important disease processes such as inflammation, angiogenesis, and DNA damage. We will then be sending off this data for epidemiological analysis to examine the relationship between this data and dementia status at death. And then we'll be performing gene expression analysis to look at novel changes in the neuromicrovascular unit associated with dementia. So I just wanted to say thank you for listening, and thank you to everyone that's made this research possible, including the donors to the CFAS Biorepository, those of us in the University of Sheffield, as well as my collaborators here in Newcastle, in Hull and in Cambridge. Thank you very much.